Hi there, I'm Dr. Natalie Montfort, a licensed clinical psychologist in Houston, Texas. I've worked in the field of autism and developmental disabilities for over 20 years. Today we're going to talk a little bit about how developmental disabilities and trauma intersect. So what is a developmental disability? A developmental disability is a delay in skills or abilities in one or more areas, like communication, socialization, language development, cognitive and intellectual functioning, or motor skills. Developmental disabilities include things like autism spectrum disorder, cognitive and intellectual disabilities, learning disabilities, genetic conditions, and other things that may fall into this spectrum. How common are developmental disabilities? According to the World Health Organization, 1 in 6 individuals have a developmental disability. That means these children are everywhere, in our classrooms, in our hospitals, and in our homes. How do developmental disabilities affect individuals with trauma?
So what might developmental disabilities look like? My purpose for this slide is not to label people or to categorize people or to say these are all the things that make them different or odd. My purpose for this slide is to help you think about what might you notice as you're working with kids that might indicate to you that there's something going on that's a little bit different, that maybe we need to take on a slightly different approach in working with these kids. So differences in intellectual functioning, not just tested IQ scores, but differences in intellectual functioning can look a lot of different ways. For example, it may affect the way that they understand how things happen. They may not fully understand the concepts or the nature of something that was traumatic or why they had a traumatic response to a specific event that happened. They may not understand that trauma has occurred at all. They may not know that what happened to them was bad or was something that they should be concerned about. They may not associate the idea of cause and effect. They may not understand that when this bad thing happened and then I felt scared, now I feel scared in similar situations. They may not be able to understand that connection. Think about how doing trauma work with somebody who can't associate their trauma with their triggers could be a little bit difficult. Differences in language functioning, and this is both receptive and expressive language. Again, think about how working with somebody who has these differences could affect how you have to work with them. They might not be able to describe what happened to them. They may not be able to tell you about what happened. They may not have words that are able to articulate. I was super glad at the very beginning that we talked about vocabulary and using terms that are scientific and are very specific, because again, if these kids don't know what certain body parts are called, for example, they may not know that something bad has occurred. We talk a lot about therapeutic language. We talk about very abstract concepts. We talk about mindfulness and things like that, where these kids may not have a conceptual understanding. They may not, unless it's something they can see and touch and hold and physically understand, they may not have a point of reference to understand what that means. We do in a lot of our trauma work in TFCBT and even in cognitive processing therapy, we do a lot of narratives where we write, we talk. Occasionally we'll even do a lot of reading. That might be difficult for someone with a learning disability or someone with a cognitive disability. Understanding what that might look like in that setting. We talk a lot about social functioning, especially in the world of autism, which is kind of where I come from a lot. It's tough to put those in just a couple of bullet points, the significance of the impact of social functioning in some of these concepts. To identify and avoid potential threats requires relatively sophisticated social skills and social understanding. If you have differences in the way that you process social information, you may miss that. It may put you into a circumstance where you're not sure if the person that you're talking to is someone safe or that the thing that happened to you is safe or not. Under recognizing when an interaction is inappropriate. We talked about normalizing, that this may be totally normative for them, that this is how people treat each other. They may not even know when I ask, has anybody treated you badly or has anybody hurt you? Well, not outside of what's expected. They may not know that that's not okay. And again, with the know who to trust. They may not know who to trust. They may not know that you're a safe person. They may not know, who they can share that information with. And the differences in social functioning is, again, tough to sum up in just a couple of bullet points, but I think that those are some key ones.